It is a huge honor for me today to be podcast interviewing Dave Shirazi, and I'm not even going to try to explain all the letters after that. I'm just going to read your bio because, man, I am so excited to have you on today. Talk about a dental unicorn. I like to find unicorns. You know, everybody, there's enough dentists talking about a filling, a crown, a root canal. Man, you are as outside the box as they come. Dr. Shirazi graduated from Howard University College of Dentistry in Washington, D.C. in 2000 and earned a master's degree in Oriental Medicine from SAMRA University in 2006 and is also a board-certified, board-licensed acupuncturist. He has completed over 2,000 hours of continuing education in TMD and facial pain, craniomandibular orthopedics, and sleep-disordered breathing. He has also completed a hospital mini residency in Oriental Medicine at the China Beijing International Acupuncture Training Center, which is the only organization the World Health Organization has authorized to teach internationally on acupuncture and herbology, and another at Kyung Hee University and Medical Center, the top medical hospital and medical research facility in Korea, I assume in Seoul. In 2011, he became a board-certified RPSGT, the first and so far only dual-degree dentist and RPSGT. He is the founder of the Bite, Breathe, and Balance Study Group, dedicated to the multidisciplinary approach to treating craniofacial pain and sleep disorders. Dr. Shirazi is the director of the state-of-the-art private practice, the TMJ and Sleep Therapy Center of Conejo Valley, Conejo Valley. Conejo Valley. That is limited to the treatment of TMD, craniofacial pain, sleep breathing disorders, and craniomandibular orthopedics. His practice is part of the TMJ and Sleep Therapy Center International family, one of over 30 centers throughout the world, and is located in the beautiful hills of Thousand Oaks, California. And personally, Dr. Shirazi enjoys hiking and camping in the state parks, traveling and speaking. He is married to the love of his life, Kimberly Shirazi, and have welcomed their firstborn, Maximus, 2 years ago. They live in the Malibu Mountains, where they are very close to nature. And I kid you not when I say this, I had Eric, Greg, Ryan, and Zach, and if I was going to have a fifth boy, it was going to be called Maximus.
Really?
I kid you not. Now, was that from the movie?
Yes, partially. It was kind of stuck in my head.
What was the name of that movie? Gladiators.
Yeah.
But, and Maximus, what a strong name. It's like Zachary,
Exactly. And in Latin, it means the greatest. And, people live up to their names.
So Maximus in Latin means the greatest.
He's the greatest.
Huh. That was a great name. Well, give old Maximus a kiss from Uncle Howie. And my God, you are a dental unicorn. I don't know any dentist who studied in Beijing and Korea and the United States. That is amazing. So tell us about your journey. What made you leave the United States and go to China? And what was that like living in China and then to Korea? And I mean, walk us through your journey as if we just met in a bar and we're having a beer.
Well, I was in my last year of master's training in Chinese medicine. And an opportunity came up, to do the hospital residency in China. And so in Beijing.
How does a residency pop up to go to China? I mean, how does that pop up?
Well, all of my I went to the first accredited acupuncture school in the U.S. It's called SAMRA. And all of my instructors were fresh off the boat from China and Korea. And so as a student who only speaks English, we would try to translate their Chinglish and Kinglish because it was very kind of hard to decipher. But because they had ties to their country of origin, where they went to school, they were able to get some students over to do residency. So we got to go there. I wanted to know if there was anything that I was missing out on, things that they teach in the U.S. that they don't teach over there, back where it comes from. And actually, I know this is going to sound odd, but it wasn't too different in terms of the didactic training. Because the country is communist, they have a very regimental definition and outline of what Chinese medicine is and how it can be taught. So the first, SAMRA opened up in 1969, well after the communists took over. So when they opened up and they had their curriculum, they actually brought them down from China because their communists just had to be just that way. you know? I mean, their hygiene levels are different than ours. Certain techniques that they do is different than ours. Of course, the culture is very different from ours. The food is delicious, by the way. I had a great time there. The air quality is, I think, the lowest you can find in the world right now. We were, after just a couple weeks, we were coughing up blood and soot because the air quality was so bad. And then the opportunity came up in the same year to go to Korea. And that was amazing. That was one of the greater experiences of my life. Because their hospital system over there puts ours to shame. There's no other way of saying it. Their system is so far advanced. In that hospital, every physician that graduates is a traditional MD like we have here, but they also have a PhD in Chinese medicine. So they're dual degree, every single doctor. And they use, traditional surgery, they use traditional drugs like we do here, but they also do acupuncture and they also do herbology there, but on a whole other level. Like, so they'll extract the herbs and then run it through a liquid chromatograph to make sure that the molecule they want is there. And then they'll make it into a topical or an injectable or a pill or a powder or whatever. And it's just on a whole other... Like, for example, while I was on rotation, there was a stroke patient that came in, had a history of a stroke, right? So the doctor chose to treat them with acupuncture that day. So he goes on the mainframe and looks up the MRI to see where the infarction was, and then does the acupuncture to match what's for that infarction. I mean, just on a whole other level. Just on a whole other level.
And a lot of Americans, Americans always think they're number one in everything. I mean, I think the only thing America's number one in is self-esteem and confidence. And anybody who comes here with a different thought, they're going to get shut down. I mean, there's not one dental school. Is there any dental school in the United States out of 56 that teaches one class in acupuncture or herbs?
Not that I know.
Or herbs? Is it herbs or herbs?
It depends how you want to say it. I say herbs.
Herbs. Well, my name's Howard, so I want to emphasize that H. So explain. First of all, I want to start with diet and dental decay in China versus Korea versus USA. Is any of their diets more prone to decay or less to decay between China, Korea, and the United States?
Well, when I was there, which was in 2006, oh my God, 9 years already. When I was there, maybe it was 2005. They had actually a mixed Chinese and Western diet and a Korean and Western diet. So the traditional Chinese diet didn't leave much for decay. They didn't have processed foods, right? In fact, they were, insects and rodents and things like that was part of their diet, as well as herbs, as well as the fruits and vegetables. So the less processing you have of food, therefore the less refined sugars, the less decay you're going to see in teeth. In what was interesting in Korea, especially Seoul, they love Western culture. They love Western culture. So coffee bean.
In China and Korea?
No, Chinese hate American culture. The Koreans love American culture. And so they had, McDonald's, Burger King, coffee bean, they had all of that. And they had a small epidemic of obesity. And so when I was there, I actually spent a day doing a fat clinic rotation, which wasn't a problem in China, but it was a problem in Korea. And basically, it consisted of doing basic exercise and a traditional Korean diet. that was their treatment. And
so why did the Chinese, when you say they hate American culture, was that more with food, movies, politics, religion? What do you mean by that?
Kind of all of the above. I mean, they welcomed me. I mean, they welcomed my class. We went with, I think it was a total of 10 of us that went. They welcomed us because we were there to learn from them. Okay, we were paying them for a service. But in terms of the cultural love of how we live our lives, there wasn't, I didn't see any affinity. Now, secretly, would they have loved to have the kind of freedoms that we have? I think so. I think it would be naive to think otherwise. But, just like you said, like every dental school thinks, like every American thinks they're the best at everything, they think they're the best at everything.
I noticed that I've gone to China and Hong Kong, and I noticed that when you're in America and you just say, okay, name one president or prime minister or the top dog of China? Just name one. Almost no American can name any. If you say, well, who's the president of China? They have no idea. Well, name any president of China in the last 10, 20, 30 years. They can't name one. And when I go over to China and was talking to their dentist and everything, I didn't meet one that knew any U.S. president from George Washington or Ronald Reagan to Washington. So,
Yeah.
but what I would ask all of them, well, what do you think of when you think of the United States? They would only name products. They say, oh, I said, well, what do you like the United States? I mean, what do you think of the United States? They go, oh, I love the United States. I said, well, what do you love about it? And they go, Hershey's, chocolate bar, Reese's, Coca-Cola, Pepsi, and they would just name things that they bought from this country, but they didn't. Just like over here, no one knows who Mao Zedong is. You know, over there, no one knew who George Washington was. And I saw a total just product base. What do you trade?
Yeah.
Now it might have been different for you being in a university setting where everybody was highly well read.
Yeah, yeah. And you know what's interesting about everyone being around me highly well read, you know, medical school is free. The government covers it. So, and in China, unlike Korea where you do both, you do either Western medicine or traditional Chinese medicine. So you take a test after high school, and if you pass the test, then you can choose to go through one training or the other. Very interesting. It really is a different way of life.
So
one time, I'll tell you, this is really actually kind of a funny story. We were walking down the street, my group, looking for a restaurant. And we saw this group of, let's say, a party of 5 in front of us. And these 2, I guess, representatives from the restaurant started chasing them down. And we didn't know what they were saying, but they were, like, yelling at them in Chinese, right? And they're, like, following them for, like, a block. And then at some point, they all turned around and went back and went and ate at the hotel. And all I could imagine was that they were being solicited. Maybe they were possibly bargaining on the price. I don't know. But the whole concept of someone hollering at you as you're walking down the street to get you to patronize at their restaurant would not fly here. I'll tell you that right now. That would not fly here.
So what was the main difference between living in China versus Seoul, Korea?
Oh, my God. Oh, you cannot compare. Oh, my God. Living in Korea, and it was brief, but living there, it didn't feel like I was in a foreign country. You know, I mean, obviously everyone speaks Korean and very little people speak English, but you can get by. The people are incredibly nice. Everything was pretty clean. Everywhere I went, the air was lovely. We rented a room in someone's house. We each had our own sort of bedroom. And it was a wonderful, easy experience. China, not so much. You kind of got to be on top of your game in China. You can't leave your wallet hanging around. You can't, you can't assume that drivers on the street are going to stop for you. It's a very different mentality.
And who do you think, as far as living your life existence on the third rock from the sun, who do you think was the happiest and giggled the most that in the 3 civilizations you lived in? The United States, the Chinese, the Koreans. How would you rank them as far as the happiness factor?
Goodness. Well, I had such a small sampling. Well, China would be last. Between Korea and U.S., it really kind of depends on what town in U.S. Because some towns, you know, like the town that I live in, Agoura Hills, Woodland Hills, you know, Thousand Oaks, where my office is, I would say that would be above Korea, right? If we're talking New York, I would say, you know, Korea goes well above the people of New York. So it kind of depends.
I've noticed that in a country where everybody is the same ethnicity, like say you go to Poland and pretty much everyone's Polish. You go to Ireland, they're all Irish. They're just not really melting pots at all, you know. But
True.
The United States, I've noticed in countries like the United States, Canada, Australia, England, that when you live in a big melting pot, people are nervous to ask any question that might have to do with race because they don't want to be called a racist or anything like that. But I want to ask you a racial, politically insensitive question. That is, some people teach that Asians have more gum disease because their cervical neck is constricted, and just the pure mechanics of calcium and phosphorus precipitating out of saliva, that Asian teeth build more tartar and calculus and have more periodontal disease. Then the opposite extreme, an African tooth, where the constricted cervical neck is the least constrictive and oftentimes bulbous, and they don't really precipitate tartar and calculus. Thus, they have less periodontal disease. And this has been confirmed to me by pediatric dentists who have practiced around who say, yeah, keeping a chrome steel crown on an African kid in Tanzania is far more, would be the most difficult, but getting it to snap into the undercuts of a constrictive cervical neck on an Asian child would be the easiest. Do you agree with that? And do you think that Asians have more periodontal disease? And if yes, is it from the constrictive cervical neck? Do you think Asians smoke more than the United States? Do you love the fact that when I go to ask a question, I just dump like 20 questions out there so you can just pick any one you want to go after?
Well, I have a thought to share, and that is, yes, there was a lot of people smoking when I was in Beijing, right? And again, that's a small sampling, because even 17 million people in one city, which was Beijing, it's still 1.5 billion people, so I can't speak for all Chinese. Now, one thing that we do know is we see a lot of people with neuromuscular tone issues having sleep apnea, okay? And we're actually, and of course, the more overweight you are, it makes your airway smaller, right? More collapsible, and therefore you can get more snoring and sleep apnea. Well, Asians have, just like how they have the shovel-shaped incisors, they have very shovel-shaped airways, very, very flat. And they are actually slightly predisposed to sleep apnea because their airway is so small to begin with. And there are studies that have correlated bruxers, which I'm going to talk to you about later, the correlation between bruxing and sleep apnea, that have more periodontal problems and more severe periodontal problems.
Okay, my job is to guesstimate questions that our viewers are hearing. Explain the shovel shape. You said shovel-shaped incisors.
Well, flat. So, you know, you know what shovel-shaped incisors are, right? They look, you know, like a shovel. They have it kind of flat out and they're flat. Their airway is very flat in a longitudinal fashion. So when they, and you know, their mandibles are relatively small. So when they lay back to sleep, it's very easy to close an airway that's very thin. That makes sense?
Yes.
And they seem, in terms of treatment with oral appliance therapy, they seem to respond the best with anterior repositioning because their airway is so flat in this plane that when you bring them forward, you do indeed increase their airway. Because not everyone's like that. Sometimes people's airways are like this shape, and when you bring it forward, you actually close the airway, right? And the same thing with the Asian. If you have, you know, a longitudinal airway like this and you bring them forward, you will get to a point where you keep bringing them forward. If you don't cause a TMJ problem first, if you keep bringing them forward, you will start to make the airway smaller.
Did you see any differences in incidence of periodontal disease between Seoul, Beijing, and the United States, and any difference in incidence between TMD?
I'm genuinely not qualified to answer that because when I did my hospital residencies, it was purely on Chinese medicine. I didn't look inside their mouth. And even in my practice today, it's limited to pain and sleep and functional orthodontics. I don't really do periodontal exams anymore.
You know? So do you have a hygienist, or tell us about your practice? You don't have a hygienist?
No. It's just me. I have 7 people working for me. 3 of them are just for medical billing. I have my office manager. We have 6 operatories, 3,000 square feet. At night, my office becomes a sleep lab.
Wow.
So we take the chairs we have. We don't have dental chairs. Half of my chairs are sort of massage chairs. And the other half of the chairs are oral surgery chairs, only because you can recline them so I can do acupuncture. And when we're doing a sleep study, we have them on sliders, so we just push them off into the corner. And we have, they're called cabinet beds. So it's a queen-size Tempur-Pedic bed shoved into a cabinet, trifold. And so when it's time to be a bed, you open up the cabinet, the walls of the cabinet become the frame of the bed, and it becomes a queen-size Tempur-Pedic bed, and then we do our research. We do our sleep studies.
And how long have you had this practice?
In this location with the sleep lab, 2.5 years.
And how's it going?
Great. It's really great. We were in, our previous location was a block away. We had 2,000 square feet and 3 operatories. and we just needed the space, so we blew it out. And of course, I'm very passionate about research, both studying it, reading it, doing it, and this became a great opportunity to do research.
I think you should create an online CE course on Dental Town to start educating these dentists. I mean, you are so.
Well, I would love to.
I would love that. That is amazing. So where do you want to where do you want to start this? Bruxism and OSA.
Yeah. So
explain OSA.
Okay. So obstructive sleep apnea. All right. So 90% of apneas are either apnea, physical blockage, or hypopneas, which I'll explain, and 10% is central sleep apnea, where the CNS just tells the body not to breathe. Okay? And that's a whole other subject. I can answer that for you if you like as well. But in the apnea category, we have apneas, which is where there's a physical obstruction in the airway, in the upper airway, of 10 seconds or greater in duration. Okay? A hypopnea is when there's a shallowness in the breathing, the sort of breathing, that causes 3% or greater oxygen desaturation. Medicare decided to make their protocols for hypopnea 4% or greater desaturation, but I don't take Medicare, so I just call them 3% desaturation. You can have what's called a RERA, respiratory effort-related arousal, which is essentially like an apnea, but it didn't take 10 seconds. But it caused an arousal. And arousal, this is something that's never talked about. But arousals are incredibly important. And what they are is when someone's in a deep stage of sleep, be it REM, stage 3, stage 2, and they have an airway event, whether it's snoring, whether it's the RERAs, whether it's the apnea or the hypopnea, and it kicks them out of that deeper stage of sleep into a lighter stage of sleep. And that's very, very important because just having those arousals, you can have a diagnosis of insomnia. You can have all the symptoms that you can get from sleep apnea, the depression, the anxiety, the hypertension, the type 2 diabetes. That's all it takes to raise your inflammatory markers up, right? And when I first started doing this, a lot of it, when I talked to dentists, about how they follow up with their patients, they would have their patients do a log. Like they would write down, oh, last night I slept great, felt great when I woke up, appliance is fine, a little bit of jaw pain, etc. And I would ask them, well, don't you do a sleep study? Even a home sleep study? And they would say, no, this is fine. Maybe one day I'll send them back to the lab to do an in-lab study. And the problem with that is you can have a patient that had a lot of arousals prior to oral appliance therapy. You treat them with oral appliance therapy, their arousal index goes down, and their brain is mentally sleeping better, but they're still having an oxygen problem and an apneic problem, right? But you wouldn't know that because all you have to go on is a subjective answer. That's why sleep studies are so important, whether it's home or in lab.
And talk about the pros and cons of a home or a lab. Like you're doing them in your own office.
I offer both. I offer in lab and home, and I have no bias. I will tell the patient what's in their best interest. So I'll tell you what, the bottom line comes down to this, because obviously a PSG, which has 20 leads on the patient, they're measuring their brainwave activity, their muscle activity, their airway flow, their thermos, thoracic inlet and outlet, limb movements. They have everything kind of covered. And there's someone watching them. There's a sleep technologist watching them sleep. So if they have a cough, right, that's going to make their EKG go crazy. It's going to make their brain waves go crazy. But if you didn't know that that was an artifact, then you might score that as a possible event, right, of some kind. So that's obviously the best test. Home sleep studies are between 4 and above leads. Usually you don't do less than 5. Type 4 is they only do 4. That's like a watch pack. But the way I approach it with my patients is I'll tell them, look, when you go to a hotel on vacation, how do you sleep that first night? Can you just flip the light switch and you're out because you're so tired from traveling or what have you? Or does it take you 2-3 days to get used to that bed? Right? If they say it takes me 2-3 days to get used to the bed, I'm going to nudge closer to getting a home sleep study because I want something that's more realistic of what a typical night's sleep is for them, right? But if they tell me, Doc, you know what, you turn off that light switch, I'm out, it doesn't matter where I am. My wife could sleep on a bed of nails on her face. She has no problem sleeping, you know? So she would be someone, and I've done it before, but she would be someone that you would do a full PSG on.
And explain what PSG is.
So a polysomnogram is the sleep study where you go into the lab and you put on those 20 leads, like the EEG, EMG, EKG, and et cetera, and a sleep technologist watches you sleep the whole night and scores it, and a physician interprets it.
A very common question that I'm seeing a lot from the, you know, everybody's talking about sleep medicine now. What about 3-year-olds? I mean, what do you do pediatric patients with this? I mean, at what age would you be concerned about a kid having sleep apnea?
Birth. Sleep apnea is much more problematic and caustic the younger the child is. And the reason is, as adults, about 25% of our sleep is REM, where we do our memory consolidation and our mental rest. And about 15%, 10 to 15% is delta, which is stage 3. Stage 3 is where over 90% of growth hormone is released. So it's incredibly important. The younger the child, the more their sleep is predominantly either delta or REM. So for an example, for an adult white male, if they have 5 episodes of either apnea or hypopnea per hour, that's actually considered within normal limits. Okay? If they have 5 to 15 per hour, that's considered mild. 15 to 30 is considered moderate. And anything over 30 is considered severe. And the way they got that number was, after they did sleep studies on these patients, they looked at their health history. And if they noticed diabetes, hypertension, stroke, etc. in their history, and they looked at their score, they all, on average, had about 30. And the numbers went up. I've treated people that are 127. So these numbers go way up. When they noticed that people that had 15 to 30 category, they noticed these patients had pre-diabetes, pre-hypertension, you know, right on the border, right? And the mild category, again, this is white males only, they found they had mostly excessive daytime sleepiness. They were tired. Now, coming back to the child, if a child, let's say younger than 12, has an AHI of 1.0 or greater, that's severe. That is severe because you're interrupting so much of their good sleep that they need.
So what percent of pediatric dentists would you say have ever ordered a sleep study for a pediatric patient?
Pediatric dentist.
There's 210,187 dentists in the United States. 80% are general dentists. California has the most dentists at 33,242, and Vermont has the fewest at 297. But for our pedodontist friends, how many of them do you think do sleep apnea observations, sending home a test? I mean, if it's so important, it's so much more important with children, with their growth. But what percent of pediatric dentists do you think are on top of this?
Very low. I don't know what the numbers are, but I suspect it's extremely low because, as you know, every time new research comes out or new guidelines and protocols comes out, it takes a while for people to kind of change their ways and move forward. So it was only just recently where the American Academy of Pediatrics, American Pediatrics Association, just announced that every kid should be evaluated for snoring.
When was this announced?
I believe this year. I believe they started that protocol just this year.
Wow, I did not hear that.
Of course it didn't. It's brand new. It's brand new. I'm sure most of the pediatricians in my area haven't heard about it either. So there's going to be a little bit of a disconnect before you get from the changes to the actual change in behavior to it trickling down to a pedodontist. Right? And the people that are going to know about it are going to be the people that dedicate their lives to it.
I think it's funny how pedodontists get very mad when you call them pedodontists. They want to be called pediatric dentists. And old school is pedodontist, and I just think it's cute that they find offense by that. It seems so harmless. But you know, dentistry is way behind the curve. I mean, oral cancer is surging with HPV that they won't, dental insurance companies won't cover. oral cancer screening on most of them. They won't. Our state boards will let us give an HPV vaccine. As a public health dentist, I'm not even allowed to give a flu shot, but a pharmacy tech can at Walgreens or CVS. But I noticed one of the first things you opened up with is that you had 7 employees, and 3 of them were medical billing. So is that kind of the wall you hit, that dentistry is not on top of sleep apnea and so you decide to focus on medical?
Well, oral facial pain, craniofacial pain, and sleep disordered breathing as it pertains to a dentist are all paid for by medical insurance. It's usually not covered by dental insurance. So that's why we bill medical insurance. Now, the reason why I have 3 is because I see as many people as I do, and medical insurance is far, far more challenging to work with than dental insurance. Far. I mean, there's not enough fars for me to tell you. When I hear people complaining about dental insurance, I just roll my eyes. I don't even say anything. I'm like, okay.
I know, and they always complain about Delta, and Delta sell, of the $105 billion industry, I mean, Delta's like selling like 20 billion of it, and all they do is complain, and then they give the American Dental Association $1,000 a year, and they don't sell a dollar's worth of insurance. And you're right, dealing with Delta compared to dealing with medical, I mean, like I said, there's not enough word FARs to describe how more difficult medical insurance is. Dentists actually have a sweet job. They work 4 days a week, 32 hours. That they make on average 3 combined average household incomes, where everybody working in a house throwing their paycheck in a hat. They average 3 combined houses of income a year. They have 3-day weekends, and they still complain.
Yeah. Yeah. Well, I'll show them my medical billing department, and they'll change this.
Yeah, I wish you would do course on this, because I think the most interesting content is thinking outside the box, and I think, man, what a fun, unique selling proposition you have. Are you getting most of these patients with internet? Do they tend to be more, recycling? Not to be rude or offensive, but I'm thinking in California, you think of tree huggers and going green and recycling and more new age. Is acupuncture and herbs and what you're doing, do you think, more popular in California than, say, Kansas and Nebraska and Oklahoma?
Yeah, I think that's a fair assessment. I think people who are more holistically minded are a bit more favored here in California, Los Angeles area, particularly than, let's say, you just said Kansas. Yeah, for sure. No question about it. But there are those who just want the traditional drug route, the way they've been being treated. And so if that's what they want, that's fine. There's plenty of docs around that do just that. Now, when it comes to sleep, I don't know if holistic falls under that category. But when in terms of pain, I think I'm the only dentist that's dual degreed as an acupuncturist.
Okay, now just stop right there with acupuncture. First of all, explain what acupuncture is, because I'm sure a lot of people just think, you're putting a pin somewhere and like this is voodoo or this is ancient that goes back 1,000 years, no research. But you feel it's an absolute science. So explain acupuncture, how it works, and why you feel it's as scientific as, say, dentistry or dermatology or.
It's far more scientific than anything in the Western culture. And the reason I say that is it's been around for 5,000 years, but for about 25 or 2,600 of those years was it actually formalized in a way of teaching, okay? And, of course, there's so much research behind acupuncture. We have thoughts about how they work, but we don't really know how they work. Functional MRI, like, for example, functional MRIs have shown on patients with knee pain, when they do an acupuncture point that's furthest away from that area, they'll actually see endorphins and enkephalins being triggered in that part of the brain where we sense knee pain. We see that. We're not sticking the needle in the knee, but we see the result there. Western medicine, on the other hand, is about 200 years old. About 200, 250 years old, right? So it comes back to, America. Where we think we have, like, the best of everything, right?
We're number one in everything.
We're number one in everything, right? So, and that the danger in thinking like that is you could miss out on something very, very good. because if you think it's all there is.
Well, explain how acupuncture works.
Right. So we have meridians that flow through our body, which are like electrical currents, like a electrical wire. And they pass through our organs, and they pass through the dermis of our skin. And in my lectures, because I teach an electroacupuncture course for general dentists, because...
How long is the course?
It's a whole day. It's an 8-hour day course.
You should put that 8-hour day course up on Dentistry, on Dental Town, because we put up 350 courses, and they've been viewed over 500,000 times.
Wow.
Because they don't have to shut down their practice and travel and spend a lot of money, and it just, we're making continuing education easier, faster.
I actually have it videotaped. I actually have it videotaped because I did it as a webinar.
Awesome. Can you put up on Dental Town?
I'd be happy to. Let's talk. I'll talk with Ryan afterwards. Yeah.
Yeah. Actually, I'm Howard at dentaltown.com, but the guy that runs the online continuing education is Howard Goldstein. So his email's HOGO. So just HOGO at dentaltown.com, and I'm Howard at dentaltown.com. But yeah, you can CC my son Ryan at you should make yourself a Dentaltown email too. It'd be a lot easier.
Yeah. So, but the course I teach, because the device, the electrical device, doesn't break the skin, you're technically not doing acupuncture, so it's within your scope of practice. And because you're going to use it for symptoms of the head and neck, like dental, oral, head, neck, TMJ, then that again is within your scope of license, scope of practice. Right? But going back to that, there's electrical currents that we have throughout our body, and the energy that flows through it we call chi. Okay, in Japan they call it. Well, it depends how you want to spell it. So some people spell it CHI, some people spell it QI. But it ends up the sound is chi. In Japan they call it ki, like KI. But it's the same meaning, right? And so in Chinese medicine we say when there's a pain or even a paresthesia or even a numbness, we say that there is a blockage of the chi, okay? And it's our job to go, okay, well, where is it originally coming from, and what are the points that are related to the area that I'm trying to treat that will resolve this issue? It's very organic. They look at things of being in excess or deficient, things of being cold and hot and damp and dry. It's a complete 180 from the Western mentality. Complete 180.
Well, I notice as you deal with a more higher educated, like I'll give you an experience that I just heard yesterday at the gym. Somebody thinks they have injured their rotator cuff, and someone said, well, here's the name of my orthopedic surgeon, and this is a very successful older 50-year-old person. He says, hell no, I'm not going to an orthopedic surgeon. The only way they make money is to fillet me open. He goes, and I'm first going to go to Dr. Angie because she'll try everything minimally invasive. She'll exhaust everything non-surgical, and I want to give my body a chance to heal. So I already see in America that the highly reading, literate, and most intelligent people are starting to become afraid of surgeons and pharmaceutical companies. I mean, they just see all the side effects, they see all the surgeries, and they're like, I want to slow down spanking, and they're going to be a last resort. Taking a pill and getting filleted open is now becoming a last resort. And what you're doing is the up and coming, I'd almost call it minimally invasive dentistry. You know what I mean?
It is the same mindset. And I do want to address what you said, because indeed, every doctor should have the mentality, let's treat this as conservatively as possible. Not just financially conservative, but let's be as conservative as possible so that we don't do anything that's irreversible. Because once you have surgery, there's no going back. There's no going back from surgery, right? Now,
I'll give you an example, like treating the worn dentition. What do? Well, the teeth have worn down, so to repair that, we'll file the whole tooth down until it looks like a grain of rice and then put a crown on it. Yeah. Wow, so to treat wear, the first thing we do is shove the tooth in a pencil sharpener. Yeah. And we crowned it to prevent more destruction of the enamel. I'm pretty sure, so the mindset is changing.
Yeah, and I hope so. And I hope it does change, because in that same case, because we always see these cases, these patients coming in with these closed verticals with, you can't even see their lower incisors. They're so collapsed in. When we see these patients, we should be thinking, well, why have they worn their teeth then? Why are they in my office today? And if their VDO is that lost, what does their jaw joints look like? You know, that should be their mentality. Not, you know what, I'm just going to protect these teeth with the Bruxism crown so that he can't wear them down. Well, why? Is he bruxing because he's trying to keep his airway open? I mean, because that is a known thing. If it is, well, just covering it up with a zirconia crown isn't going to really help the patient in the long run.
Do you think you can cease a patient grinding and make them a oral appliance, a night guard, without doing a home sleep test?
Okay, I'll tell you exactly how I feel about that. My local dental society, who I love very much, when I first came into this community 9-10 years ago, they asked me to do an editorial on TMJ, kind of like a full-page sort of thing in their newsletter, right? I did it. They loved it. They go, fantastic. Can you do one on sleep too? I said, I would love to. Are you kidding? I love education. And so I wrote it, and in it I put down that in the future, I foresee that if a dentist sees bruxism in a patient and just doesn't refer out for a sleep study of any kind or to a sleep specialist of any kind and just sticks an NTI in their mouth or a night guard, that will be seen as malpractice. Okay? And when I put, they wanted me to remove it, and I wouldn't, and so they didn't publish it, which I understand. We don't want to get any of our brothers and brothers and sisters in trouble, obviously. But it is important to get the word out there that you don't just do it. I mean, I remember you had Dr. Steve Olmos on here, and he was talking about the great study out of Montreal, with Dr. Guy Levine, where he took patients that had sleep studies and had sleep apnea and didn't wear their CPAP, but had their night guard. So then he said, all right, wear your night guard, and then let's do another sleep study and see where you're at. And 40% of those patients, their apnea got much worse by wearing the night guard versus nothing, right? And the worse their apnea, the worse it got with the night guard, right? We could postulate that because the initial opening of the mandible is rotation and then translation, that initial rotation actually brings the mandible back. So when you put a night guard in someone, you're not really doing their airway any favors. We can postulate that. But the fact remains, no one looked. No one did an x-ray of their airway. No one did an x-ray of their jaw when they made them a night guard. In fact, most dentists that I see make night guards, they don't even take the jaw position. They just have their assistant take the molds. They send it out to the lab. And the lab goes, that's okay. Right about there, it looks about right. It looks like centriculation. I'm just going to put them in there. And it's completely arbitrary. Does that make sense?
Absolutely. So what kind of x-ray do you like? Are you doing a 2-dimensional pano? Are you doing a 3-dimensional CBCT?
Oh, I'm doing CBCTs. No, panos, I mean, 2-dimensional dentistry is quite over. It's quite over. There's so many other aspects to look at.
What CBC did you get? The dentists always tell me, be specific. They're always saying be specific, no generalization. So what CBC did you pick?
I have the iCat Next Gen.
The iCat Next Gen?
Yes.
The iCat Next Gen. And where's that made out of? Where's iCat out of?
Out of Georgia.
That's out of Georgia?
Imaging Sciences, yeah.
Imaging Science out of Atlanta?
If I'm not mistaken, yeah. It's an American company.
What's that?
It's an American company. The others are Korean and Italian.
What are the other ones you like?
Oh, goodness.
What's the Korean and the Italian one?
I don't know their names. I'm sorry. The Korean one, I just know is a lot cheaper. The Italian one is a lot, it's extremely more detailed than the iCat, but it's a lot more radiation, a lot more, and the patient lays flat on the table, which I don't like because the mandible can flop back. So it doesn't work for most dentists. Maybe it works for an oral surgeon.
And what about the sleep home study? Which system do you like?
Well, I'm biased. I like Somnomedics because...
You like which one?
The brand is called Somnomedics.
Spell it.
Somno, S-O-M-N-O, Medics, M-E-D-I-C-S.
And what's Somno stand for?
Sleep.
Sleep? S-O-M-N-O?
Yeah.
You mean the whole word means sleep?
Yeah.
In what, a different language? Greek, Latin, what?
I think it's Latin.
So somno is Latin for sleep. I did not know that.
It sounds like sueño.
And I was an altar boy. I should know all my Latin.
It sounds like sueño, though, doesn't it? Somno, sueño.
Yeah.
Yeah.
In Spanish.
Yeah. Latin, you know, is a verb.
Do you speak other languages?
I speak Farsi and Spanish, yeah.
Farsi and Spanish, so neither of those helped in Beijing or
No,
Korea.
unfortunately, nothing helped. No.
I mean,
English was my best bet.
English was your best
And
bet?
I have to tell you something about that and China. You know how there's this stereotype that French people are very arrogant with their language, and if you don't say it just right, they get all up in arms? No, I've been to France many times. If you try to speak their language, they love that you try. They're very nice, right? In China, no matter how much you try, no matter how many times you like humor them, they're always correcting you. And they're not nice about it. They're always corrected. No, you said that totally wrong. And it sounds exactly the same what they say. But yeah, just on the side note about the language, yeah.
I think that is the one thing I could not do. I think I miswired on sound because the happiest day of my life was not the birth of any of my 4 children. It was the day my mother told me I no longer had to take piano lessons. And my piano teacher said that I couldn't carry a tune in a lunch pail. And the only D I ever made was in Spanish. And San Martin, the teacher, told my mother that I was linguistically retarded. He said, I just say the same word to Howard 10 times in a row, and every time it comes, he goes, I don't think his ear is connected up to his mouth. And so I have a piano teacher and a Spanish teacher saying I am not gifted in sound. And one of the two's got to be right. But that's but Somno. So tell me, how much is that Somno Medic?
It is, if you're getting it purely for HST, it's about...
Explain what HST
home
is.
sleep study. If you're using it just as a home sleep device, it, at the time that I bought it, which is several years ago, was $5,000. Right? Now, I'll tell you, the reason I'm biased towards it is because, in my opinion, they make the best in-lab equipment. Right? And if you get the in-lab, that costs $25,000 for the whole shebang. And
you have that in your office?
I have multiple ones of those in my office, yeah, because I got 3 beds.
So you pay $25,000 per bed for 3 beds from Somno Medics?
That's correct.
And where are they out of?
They're out of Germany.
Germany?
They're out of Germany. And for their PSG, all the best universities use it for their research. Stanford, NYU, Arizona, they use Somno Medics. And the reason why I like it.
And what does the PSG stand for?
Polysomnogram, that's the in-lab study. Yeah. The reason why I like them so much is they're the only product now where you do the in-lab study and they're not tethered to the nightstand. So the head box, in like let's say Alice equipment, which is about $10,000 a room, you have all your EEG leads plugged into a box that's on the nightstand, right? So you're tethered, so you have to sleep on your back. You can't move, otherwise you'll pull the leads out and the lab tech's got to come back in and re-plug them in. But with the Somno Medics, the head box is on the shoulder and the unit is entirely wireless. So you could roll around in the bed.
Nice.
If you have to go to the bathroom, you just go and you come back and you go back to sleep. There's no re-plugging in nonsense.
So you could take a date to the study.
If you wanted to, you could.
That is nice. Wireless. I mean, that is just an obvious. And when you do that so when you send it home, this machine costs $5,000. What do you charge for them to take it home?
My sleep lab charges $450 a night.
For them to sleep in your dental office?
No. There's much more to sleep in the dental office. For the home sleep study, I charge $450.
And do patients pay you $450 on their visa, or do you bill their medical insurance for this?
Usually both. So by the time we've done it, we've already received authorization. We have an idea of what they're going to pay, and we know what the patient's portion is going to be, so we charge them. We charge them just their portion.
And what does that usually come out to be of their portion versus the insurance?
If the insurance covers 80%, then we charge them 20% of $450, which is $90.
And how many times? I mean, do you send someone home with this every day then?
Almost every day, we're doing a sleep study of some kind.
And then they bring back, and then you just download this to your desktop computer, and
Yeah,
it shows a report.
yeah, it has an auto score feature, but because I'm a sleep technologist, I score it again, and I go and send it to our medical director and have him do the interpretation.
So you have a medical director in-house, or do you send it outsource that?
We had one in-house up until earlier this year, but now we chose someone that's up in Northern California.
Interesting. And does he work with dentists and physicians and sleepologists, or is this?
Yes. Yes, and the reason I like him and I like my previous medical director is neither of them own their own dental lab. Okay, physicians that own their dental lab, they make their money from doing sleep studies in a lab. They make their money from selling CPAP equipment. So they don't like the other options. They don't like the ENT consult. They don't like the oral appliance option. If they don't do it, they don't like it. So when they do their interpretation, they'll say recommended treatment, CPAP. And it's a real shame. Now the ones that are not owning their own sleep lab, they are very open to all possibilities, right, in an intelligent manner. And they're open. So I had one of them send me a patient, and they said, Dave, this patient can't handle the pressure of their CPAP. I want you to do a combination, like an appliance with a CPAP, because I do that a lot. And when I evaluated, when I listened to the patient's complaints, I called the doctor up. I said, if you switch his machine from a CPAP to an AutoPAP, I guarantee you he won't need an oral appliance. He'll be just fine. And he goes, okay, I'll do it. Right? Now, the reason why most physicians don't like to do an AutoPAP is because the AutoPAP does a sleep study on the patient every single night. Right? And insurance companies know this and don't like to pay for multiple follow-up sleep studies if the device is doing it, justifiably. Right? So I like working with doctors that are open-minded and don't have a financial interest.
So many times you can summarize every decision. I'm always telling my kids, they'll say, why do you think this happened? I'll say, well, money is the answer. What's your question? And that pretty much sums up about 80% of all questions when my boys see something that doesn't make sense.
I would even say higher than that.
You'd say higher than that. And I don't know, do you think America does that more or less, or do you think it's a global problem?
Well, it depends. So if you're coming from a country that has their medical and dental paid for by the state, then there's less of that in that industry, right? But when it's a more private sector, we see more of that.
And how was dental paid in China and Korea? Do you remember that?
Dental pain or payment?
No, payment.
I have no idea. I don't know. I know that Chinese medicine, acupuncture, and herbs is a covered benefit under the,
So you have an all-day webinar on this?
On electroacupuncture, Chinese medicine and electroacupuncture to treat orofacial pain. Exactly.
Wow, and you're thinking about putting this up on Dental Town?
Absolutely. I'm flattered that you invited me.
Oh my God. I like I say, I look for dental unicorns, and you are a dental unicorn, and you're a neat guy, and I love listening to you. So I've only got you for 7 more minutes, and we haven't even mentioned herbs.
Okay.
Do you mind going into herbs for a little while?
I don't mind at all. I don't do too much of it in my practice because, for example,
because I have some experience in herbs. I smoked some in college. And
right. Well, I'll tell you, the research on cannabis oil in the treatment of a host of medical conditions, nearly every cancer, lung cancer, breast cancer, brain cancer, the research, the evidence for it is frankly overwhelming and overwhelmingly positive.
Yeah, I think the most hope I have about the future of civilization is, if you just look back at a snapshot of civilization every 100 years back all the way to the Great Wall, it just seems like we just keep moving forward. And I never would have guessed when I walked out of college that someday marijuana and gay marriage would be legal.
Yeah.
I mean, and I think a lot of people, people listening to you that are 40, 50, 60, 70 are thinking, oh, that's crazy. And a lot of kids that are 40 to 30 to 20 are thinking, wow, this is interesting.
Yeah.
My school didn't teach anything about any of this, and so you know, I just think the younger kids have open minds,
Yeah.
and I think the thing that old people should do is try to have open minds and play like children. I mean,
Yeah.
I look at my 3-year-old granddaughter. I mean, they wake up, they don't need coffee, they don't
Yeah.
need a cigarette, they don't need what are those energy drinks called?
Yeah. Monster drinks and all that.
Monster drinks and Red Bull. They just get up and play.
Exactly.
And
And that's
they're
natural.
always giggling and laughing, and they're always open minded. They're playing, and I always look at my little Taylor and think, you know, that's what you need to do at 53. You need to get up and play,
Yeah.
and giggle and have fun. And if anybody's listening to this and the hair on the back of their neck standing up and say, "That's not what they taught me at the University of Kansas City Dental School," you know, dude, you know, there's more than one. But talk about herbs. I've only got you for 5 more minutes. Talk a little bit about herbs.
Well, in my field, as it pertains to pain and sleep, I'm not doing herbs too often. The times that I'm using herbs are if the patient can't tolerate any medication. So for me, the medication route is something I use for acute cases and for cases where I still have a working diagnosis going, and to help me with everything else that I'm doing, you know, orthotic therapy, acupuncture therapy, cold laser therapy, and etc. If the patient says, you know, doc, I can't put my lips on any medication, I have a bad reaction to almost everything. I go, okay, fantastic, let's do the herbal route, right? Because I have to be honest, even though I'm here in California, not everyone comes to me and says, hey, can you treat me with herbs and acupuncture? They still want the conventional. And I have to give them their options. I go, well, you can have the conventional, but I don't recommend it for you. You know? But like, for example, for that patient, then I would do an herbal concoction. And I don't do it now. The traditional herbal way of treating it is you give someone the dry herbs and they cook it in their home and they stink up their entire house and they can't use the pot and pan anymore because it smells like those disgusting herbs. And then they, you know, plug their nose and they try to down it for a week. The way I'd rather do it is I put it in a solution of alcohol, about 40% alcohol, very strong. And they just take like a little dropper full and wash it down with some OJ. And that's it, you know. And sure, it tastes bad, but so what? It's just a few seconds, unlike drinking a whole pot of this.
Well, see, I'm Irish, so we're used to that because Jameson whiskey, you know, you got to slam that too. That doesn't go down very smooth. But you know what? You know, a holistic thing that I've seen in my own personal life, no names mentioned, family member, morning GERD, and you know, I'm a dentist, and you see GERD, and all these physicians want to give you these pills and this and that. Nothing's working. Nothing's working. And then a holistic website said, you know, if you take a shot of vinegar, apple cider vinegar before bedtime,
raw,
and so got a shot glass, shot, boom, and it just worked like turning it off like a switch. And I'm like, how come none of the physicians and when you talk to your physician, like, oh, like that, would you learn that off on the internet? It's like, dude, yeah, but they had no problem writing a script for something that had 20 side effects and cost a lot of money in insurance. And then now my buddy's drinking a shot of apple vinegar and the morning GERD's over. And then when he falls out of the habit and doesn't do it for 2 or 3 or 4 days, boom, it's back.
It's back. Yeah.
It's back. And it's like, and that's what's sad about it, because nobody's making money off vinegar. So nobody's going to be talking about it. There's not going to be any commercials on TV.
The thing is, the more specifically, you're absolutely right. They're not making money off it, so they're not paying for a research study on GERD patients with apple cider vinegar, right? When you see, you know, what is that called? The purple pill. I can't think of it right now. But when you see that commercial, there was a pharmaceutical company that said, hey, we could sell this. Let's pay for some research. Let's go through FDA 1, 2, 3, 4 trials, and let's get this out to the public and let's make money off of it. There aren't very many people that are testing things that are all natural.
And what really I thought was the most un-American thing that I ever heard in my life is a lady on my street that wanted to try this new chemotherapy for brain cancer, and she's not even allowed. They're not even allowed to give it to her. And I say, so she had to, with brain cancer, 7 years old, had to sell her home in Phoenix and move to Scandinavia, just have the freedom to take a pill on her own right. I mean, the fact that our government, you know, I mean, they talk about NAFTA and free trade zone. The fact that there's no free trade zone Maybe, you know, where they have casinos. Maybe there should be a free trade zone where you can say, hey, this is no FDA territory, and you shouldn't have to move to Denmark to try something when you're going to die anyway. And why didn't she have the legal right to just sign and say, look, all the doctors say I'm going to die anyway. It's my life. I want to try this. And the government's, no, you have to leave the country. And I just thought, that is just sick.
I'll tell you what, in terms of medical tyranny, that is just a drop in the bucket. The whole concept that alcohol and cigarettes are legal, and we know the kind of ramifications from use of that, and something, an herb, like you said, like marijuana, which has very few, I mean, really, the side effects of marijuana are it makes you happy, sleepy, and hungry. That's basically it. Very, very few side effects, but the list of medical uses is off the charts. There's like nothing is good. But you can't package it into a pill. Right, so because it's illegal to package food as a drug, you can't do that, right? So that to me is much more of a sign of medical. I mean, think about our mindset that we would think that an herb that comes from Mother Nature doesn't have its own ability to like take care of itself and not be too much and not be too little, whereas something artificial like cigarettes and alcohol. We know, lung cancer, liver cancer, liver cirrhosis, etc., is quite all right and quite lethal.
And what's interesting is coca leaves were known for hundreds of years to curb being appetite suppressant. And here in America, a third of the people are obese, and there's not a chance in hell they'll ever sell coca leaves to chew on like a gum for an appetite suppressant in a country where 1/3 can't, like myself, have a hard time stop eating. You know what I mean?
Yeah, but on that note, and speaking of herbs, a fantastic research study came out of, I think it was either Sweden or Switzerland, I just read it last month, where they found 5 grams of spinach, whether it's powdered form in a smoothie or whatever, is as powerful a appetite suppressant as anything.
Well, I love spinach. I don't look like Popeye, but I love spinach. Hey, we are out of time. My brand's an hour. That's the average commute my listeners have to drive to work. And I just want to say that this is way too much information. I almost look at this as Dr. Dave Shirazi just flew over Dentaltown at 30,000 feet going 600 miles an hour in a 747. And the only thing I can end this is slow down, Spanky. If you got an all-day program on this, I bet a lot of kids would love it. It open their mind and make them think. I think you're amazing. I think your karma. You're adorable. I hope to see your all-day. I'm serious. I hope to see your all-day course on that. I think you. And thanks for spending an hour with me today.
It's been my sincere pleasure. Thank you, Howard.
All right. I look forward to that webinar. I'll watch it right on my big screen all day long. Oh, by the way, the new Apple TV that's coming out.
Yeah.
You'll be able to do an internet search to find YouTubes and videos and Dentaltown and all that. So with the new Apple TV, you'll just be able to search for Dentaltown. Pull up your webinar, boom, watch it right there in your big screen in your Big Daddy chair.
Perfect.
All right, buddy.
That's great. Thank you so much.
Thank you, bud, very much.
Bye-bye.